Welcome back, folks. John Sargent with Deb Drake, and we're here to share with you again from bioenergysensingtechnology.com. So we're going to jump into an area here that is a little controversial from time to time. We do have some heated discussions on it, but it's all about integrated medicine, and it's all in the changing world, and we certainly know that that's happening. And I refer to Deb as MD. And I'm not referring to her as a practicing medical doctor, because unfortunately that's not the situation right now, but actually to some areas loss is our gain, because we're working in the area of bioenergetic medicine, complementary alternative medicine areas, and having a background of many areas of learning is where the benefit comes to working with Deb. So Deb, I guess I'd have to ask you, first of all, from your opinion, is the healthcare delivery system satisfactory right at the moment? We're talking 2011.
Ooh, well, if I said no, I'd be shot. If I said yes, I'd be called a liar. So I'm going to call it a work in progress.
Well, that's good to hear, that it is a work in progress. So there are changes that are happening.
There are changes, and as they say, change is slow because we resist what was unfamiliar to us, and there's a lot of fear of the unknown. And as new technologies come in, they have to be evaluated with proper due diligence before they're released on the general public to make sure that their safety has been met.
Of course.
So I'm not saying that I disagree with regulatory bodies. I applaud them. I've been part of that medical regulatory system as a quality assurance officer for a hospital. I use continuing quality improvement, or CQI, methods in all my practice, and even at the best of my training, the best of my education, the best of my clinical experience, I can still see that we are woefully inadequate to the targets that we're meeting, that we need to meet based on many, many factors. But the key factor that I feel is missing in medicine today is, like any corporation, you should be very diligent at where you're spending your resources to see if you're getting the good bang for the buck with that money spent. And in medicine, I believe we're spending way too much money on the wrong things because we haven't mapped what we really need to spend it on. So we're doing all this reactive end of care, end of life spending. The statistics I've read said we spend 90% of our healthcare budget in the last 90 days of your life.
Well, yes, we've seen that, and unfortunately a lot of us have experienced it as our population's aging. We're starting to see more of that in our family circles and in our friend circles.
But it's crumbling it's crumbling the healthcare budget of the whole country now.
Well, it is. In fact, the healthcare system is in dire need of assistance, and that's what we're here for. That's why we're here discussing, folks. We want you to have the information. But before we get on with that, I want to ask a little bit, go back to your background a bit. We've been talking about the things that we're using, but you're a very learned person, one of the most learned persons that I know, and sometimes having to grab onto your ankles to hold on to you because you get going. But there's four major areas that you have training in, I understand. And could you just name those off, and we'll address each one of those individually?
Sure. Well, I started out in kinesiology, which is the study of biomechanics of the body and anatomy at the University of Waterloo. And I became so fascinated with the anatomy there of the body and how beautiful and exquisite it was all put together. It was just like a miraculous tapestry to me. So I went and did a biological degree in biochemistry, psychology, and biology, and I graduated at the top of my class in the University of Alberta. And after that, I received a scholarship in biochemistry research, where I started to get a look at what's happening to the first principles of medicine and how to get to the root causes.
Sure.
I was accepted to many medical schools, but I chose McMaster Medical School because it was a problem-solving, self-directed university.
So they taught you to
dive in
and think about the
Stop doing the multiple-choice rote memorization. Learn how to problem-solve.
Okay.
That is, find something that you can lock onto, then go research what you don't know, then amalgamate or integrate it into a platform that's valuable, useful, and on target.
Wonderful.
And that was one of the best experiences of my life because, albeit one of the most frightful, the first day of medical school, the dean told us there'll be no exams, no classes, you'll just be teaching yourself. and everybody ran to the John. Everybody was so used to being spoon-fed that we really got challenged that you're going to have to use your brain now and
Sick
think.
to your stomach because you're thinking, oh my gosh, how am I going to do this?
Exactly.
Yeah.
But the benefit of that knowledge base was that because you didn't know something, you went and studied it even more and in greater depth and in wider angles and looking at it from many angles. And this is probably why I'm maybe a little bit ahead of my peers in accepting technology that looks at things from many angles and not being intimidated by that.
Okay. Okay.
And
So
then
it's all investigative techniques.
Yeah, it's like you a cop. You learned many investigative techniques when
Oh,
you were...
you let it out of the bag. I hadn't said anything about that, but true enough. You know,
Well, you know what
the
we are?
investigators.
We're health investigators now.
Yes,
We're bringing detective work to medicine.
Yes. I'll just address this for a moment, folks. In my youth, I was in civil service as a police officer, and I was trained in investigative techniques. And after leaving that, after a decade of work, I was fortunate enough to be introduced to the complementary or alternative health field, and I honed as I grew into my area of expertise. I honed my investigative skills, and I call myself now basically a quantum stress investigator. I look for the root cause, along with Deb and our associates. We look for the root cause of situations, not necessarily we're reading the messages from the body. The symptoms are the body trying to tell us something. We have to look at who is the sender of that message. And this is where there's a number of things that with Deb's expertise, for instance, emergency. What were you taught in the emergency care? Very briefly, when you were working in the emergency departments, what did you look for?
That all hell can break loose at any moment, and you better be prepared and know what you're doing, because you can't tell exactly how fast someone can crash, but you could kill a person in 10 minutes without oxygen.
Right.
And yet they could smoke themselves to death over 50 years, a 2-pack a day, and never have lung cancer because they were just a happy guy.
Right.
So emotional medicine, physical medicine, social medicine, all play the part in the emergency room. Somebody may come in with a heart attack, but they couldn't afford the ICU. Okay. Maybe somebody could come in with a broken leg when I was working in California, and a guy came to the emergency room with a broken femur, but he didn't have the right color health card, so I had to put him in a taxi and send him someplace else because he didn't have the right monetary instrument to get well.
But emergency medicine, coming back to that, taught you how to identify and prioritize.
It's priorities that win the day.
And it's not always the first thing that you see, which may be the cause, but stabilize.
It may be the invisible thing that you haven't thought of. So in emergency medicine, it came down to the ABCs. If every patient came in front of you, you had to think in your mind, is it A for airway, B for brain, C for circulation, D for digestion, E for endocrine, F for fluids and filters, G for genetics, H for housing, I for immunity, J for the jacket. Which system is broken? Which one's going to kill you faster? And how can I intervene? But the problem is, you mentioned it a moment ago, if we go after symptom management, like in acute care medicine, it only affects a few of the people who are acutely affected. Most of the people, their bodies have adapted to a slow process illness, and therefore the symptoms disappear. So a symptom-free person doesn't mean a disease-free person.
Yes.
And somebody with symptoms doesn't mean they're necessarily that sick.
Well, and we see that when we see people with the evaluation devices, and we see an underlying situation. So there's an undercurrent, and many times we've seen it in a river. A river can be very calm and just flowing along. But if someone went into that river, there's such an undertow that would suck them right down. So there's no symptom or indication that you're walking into danger, but everything is under there.
Exactly.
And so if people are doing things that are lifestyle oriented, they may have adapted. The body is a wonderful thing that can adapt, right? And so it may have adapted, but in natural health, we're looking for the things that the body's adapted to and is yet to put forward the symptoms. So rather than being symptomatic care, you don't have to have symptoms to come and see us. You don't have to have life and death situations to start looking after who you are.
And if you map the early warnings, symptoms, or you profile their risk categories, you can get much earlier intervention and stop the person from going all the way over the cliff and pull them out of the boat before they've gone over the falls.
Right.
So early intervention and early warning is preventative medicine, and this, in my opinion, has not been given the budget to do. So me, as a family doctor for 25 years, I have been suspended for deworming Canadians as a proactive element when I see that they're sick with all the symptoms, even if I can't find the particular parasite in their stool culture. And therein lies the ability for us to have litigious medicine undermine all of good science.
Well, let's keep it on the area here where we're going to get into the research side of things as we go into these, excuse me, and explain to people where the research has been done and everything else. So in our next segment, folks, we're going to talk a little bit about the biochemistry of the system. So where Deb had learning out in the University of Alberta on the biochemistry side, very learned there, and a couple of other areas that can do it. So until the next time, we want to say thank you. Thanks for tuning in. Hope you're learning stuff. This is what it's all about for us, sharing with you. And
it's all about awareness. If you're aware of your body and you're aware of what we're saying, you're going to be aware and do something early, and you're going to basically prevent your own demise by being just aware. That's all we're promoting.
Well, we'll see you next time in the studio here. We're going to take a bit of a break, and we'll get back to you soon. So bye for now from Bioenergy Sensing Technology Triage.com. BestTriage.com. Talk to you again soon. Bye-bye.